Applestozen. It's Dr. Bob here with another health and vitality tip of the week. So this week we're talking about healthy hips and pelvis and healthy knees. So the problem with knee challenges is if there's an imbalance with the knee, it can affect the hip and the pelvis and the alignment. It can also affect the nerves down into the legs, and the hip problem can also affect the knee itself. So it goes back and forth. Your knee is your largest, weakest joint in the body, and it is becoming more where people in their 60s are getting them replaced. Now, I don't know about you, but I like to keep all my vital organs and joints as long as possible, so there's some simple things that you can look at as far as knee joint alignment. And first off, you got to start from the ground. Having a good custom or an orthotic that actually supports the arch of the foot based upon your foot while you're standing for a long period of time to keep the knee, the ankle, and the hip in proper alignment is one way to reduce stress on the little cartilage of the knee joint, the meniscus. So starting with good shoes. If you've got a high heel, you've got a constant stress on the ligaments, the anterior cruciate ligament, the cartilage itself. So anything more than really a 1-inch heel that's higher than the foot itself is going to put stress on the body. So making sure you've got a good support shoe, especially if you're on your feet a lot or have to do a lot of walking. When you're doing exercise, make sure you have a good support shoe that is properly for your foot. If you have a narrow foot or a wider foot, you got to make sure that you have the appropriate shoe so that you're not compressing the feet. That can actually cause your foot to roll in and cause the internal part of the knee to be affected. The hip alignment is very important. If one hip is lower than 7 millimeters dropped on an x-ray, it can put stress on the internal part of the knee. It can actually lead to a thing called sciatica. So a lot of times you'll have a warning signal of this leg pain, and then over a period of time that leg pain is just saying there's pressure on the nerves and through the lower back. That weakens or disrupts the muscles in through the hips and down into the leg. That over a period of time causes the knee to torque, and then you start to wear out the knee joint itself. So there's a lot of intricate factors. So to refresh your memory, we got to start with the feet. Make sure you got a good support shoe that's not throwing you too far forward. Make sure that your hips are in proper alignment so that they're not dropping down. In our office, we actually do a weight distribution. You can see how much more pressure you're putting on one side of the body than the other. That can determine if you have too much stress on one side. That can lead to lower back disc problems, knee problems, hip problems. So our hips and knees are totally interrelated. So make sure that when you look in the mirror, do the hips look nice and level, or do they look like one is dropped? That can play a factor in chronic knee problems. So your knee is your largest, weakest joint in the body. Take care of it. Walking consistently allows the lubrication to keep the knee balanced. So I recommend 30 minutes walking 5 times a week. Helps your heart, helps your hips, helps your knees. So another health and vitality tip from Dr. Bob. Until next time, Applestozen.